hip internal, external rotation. I'll show you both prone and seated. Or did I show you prone?
Showed us prone.
I showed us prone. We didn't get to seated, that's right. So prone, you remember, lying prone, knee is bent to 90, hip is straight, and you just really want to make sure you're not getting an AB adduction as you're turning them into IR, ER for that. Sorry, a little further back, like, there you go. You want the knee off about 2 or 3 inches. You can take a towel roll, pillowcase, whatever you might have. Ooh, thank you. Just to make sure that their thigh hitting the table isn't going to be limiting factor. This also gets the hip in a little bit better alignment, but all of your landmarks are going to be the same. So your axis is going to be middle of the patella. Your stationary arm is going to be perpendicular to ground or ceiling, whichever line of reference you want to use. Again, just make sure whichever line of reference you're using, you're following the numbers correctly on your Goni. So if I start here, my 0's at the top, versus if I start here, my 0's at the bottom. So again, just get comfortable with your Gonis. If you really wanted to get wild and crazy, you could start with the horizontal being your 0, and then you know that the red 0 is your 0. You can use whichever stationary arm you want, but you just need to be familiar with the Goni so that you're not giving me some crazy numbers. Normal for both internal and external rotation is 45. Moving arm is going to be along the tibial crest. Clear on that? So what I am going to do, I'm going to stabilize, not limiting internal external rotation, but I want to make sure I'm preventing that hip IR, ER. And I would be in front of the patient. I'll be on this side so I'm not blocking the camera, very sorry. I'd be in front of the patient so that I can watch, but I'll move off to the side so you guys can see a little bit better. So if I'm going into hip external rotation, am I going to push her towards the wall or pull her towards me? And why is that? Because when the knee's bent, it looks a little funky, but if I had her legs straight, you could see that that's the external rotation. So stabilizing here, make sure we're limiting that AB adduction. I'm going to pull her towards me, and she's bending her knee out of the way. That's perfectly fine. It's not going to affect any pain. And she looks like she's about 50 degrees. That's a firm end feel. We can preset that Goni. I'm using the wrong arm. So again, any pain?
No.
And I'm making sure you can either get off the chair, you can bend, but I'm making sure I'm at that eye level. I think some of you might have struggled with this during first term, but remember you're at the eye level, reading the Goni from there. And I'm getting 43. So 43 degrees of hip external rotation. Same thing for internal rotation. Stabilizing, pulling her out to the side. You can keep your hand on top or out to the side. Again, for this one, I'm just making sure she's not coming to AB adduction. Feeling for that first resistance. This will also be a firm end feel. Any pain? Okay. This looks like it's 45. Still good?
Mm-hmm.
And she's at 42. Questions? Easy peasy. So let's practice those, and then also practice the prone, because I think we went through that one real quick.